Good evening to all of you. Happy good evening. There was some technical glitch because of that. I could not start in time. So at the outset, I will thank Visama Kids Foundation for giving me this opportunity to share my views with you on this social platform. I'm particularly thankful to Mrs. Sudeshna from this organization for motivating me to speak. She's a great motivator, of course. And in the past, we happened to work together in one state government run organization. Though she is not cut out for a government job, but she survived in that organization for a reasonable period of time. And I must say, she did very well. Her performance was far above average than an employee of any other employee. Later, after she joined this Visamo, she approached me once because she wanted a study of nutritional status of the inmates of the Visamo Kids Foundation. She approached me and I could help her by directing her to Indian Institute of Public Health, Gandhinagar, where I suppose her job got done. A topic that which I have selected for today is the governmental and civil society response, a critical comparison. Few disclaimers before I begin my presentation is number one is that do not confuse with the title of the topic. It is not a criticism of any sector, whether governmental or the civil society, which is popularly referred as NGO, non-governmental organizations. Because according to me, both are important and have their own strengths and weaknesses. Second disclaimer is that I am a retired government servant from Government of Gujarat, and views expressed by me are purely personal and do not reflect on the previous organizations where I worked or the current one where I am working right now. Since I am not a celebrity, so I need to introduce myself. I am a medical graduate and postgraduate by qualification. As per the job profile, I have served as teacher of community medicine, which is again popularly referred as a public health in government medical colleges of Ahmedabad and Surat. I retired in 2017 from BJ Medical College, and later I joined Dr. M.K. Shah Medical College, Ahmedabad, where currently I am working as professor in the community medicine. While being in Surat, I had first-hand experience of dealing with some public health emergencies such as the plague, bird flu, recurring leptospirosis, and the flood of Surat in 2006. I think that I performed reasonably well, and as a result, I was brought to Ahmedabad in 2007 and given the charge of Gujarat State AIDS Control Society, which we in short used to always refer as GSEX. Now, this is an organization which is central government funded organization run by the state government, and its job was to implement HIV/AIDS control activities all over the state. By default, I was also director of Gujarat State Council of Blood Safety and Transfusion, which again in short we used to refer as GSCBT. Now, the job of GSCBT was to ensure universal, adequate, and quality blood supplied to the state through a chain of blood banks, where most of these were being run by the NGOs. GSEX and GSCBT together had a staff of 60 to 70 persons at its headquarters in Ahmedabad, and there were around 2,000 people, mostly counselors and lab technicians in the periphery at health centers, etc. During my tenure of 4 years at GSEX, I acted as an administrator. I used to report directly to the senior IAS officers, either the health commissioner, who also happens to be project director of State AIDS Control Society, or to the health secretary. And it is also for the first time I had interaction with the civil society organization, that is the NGOs. During this time, I also met few of the finest and the most efficient staff members who worked well and helped me in earning brownie points from health departments at the state as well as from the government of India. My subsequent observations are based of these working of 4 years. Now let us come to the popular perception of the both the sectors for each other. I am highlighting only the negative perceptions because I am going to address them one by one. Now, how about the government sector? It is a slow, inefficient sector, works very slowly, and the job security of its employee make it further slow and doing so. It is full of corrupt people. And in this regard, I would like to draw your attention to a statement made by our late Prime Minister, Shri Rajiv Gandhi. Once he said that if a rupee, single rupee start from central government, by the time it reaches to the end users, only 15 paisas are left and 85 paisas are sucked up by this corrupt system. It lacks commitment and dedication, and it just work for the pay packets. So these are the some perception, negative perception I am talking only about the government. Now, how about the NGO sector? They are only to make money by siphoning out money from the government funding. They are always looking for the government funding. That's it. They are projecting our weaknesses so they can secure more and more funds. It is like people used to criticize the movies of Mr. Satyajit Ray because he used to showcase our poverty, our ugliness, ugly belly. They keep the problems alive, don't look for the permanent solution so they can keep or receiving the funding for those problems. They have an agenda, hidden or otherwise, dictated by their funders, funding agencies. Mostly for the top authorities and NGOs, it is a type of fashion statement, discussing and magnifying the problems and in actual doing very little. Now let me clarify once again that these are only the perception, and good and bad people exist everywhere. There are good government servants and so also there are good NGOs also. And the proportion of good and bad people, they vary from place to place and from the organization. Now, what are the strengths of government sector? The first and foremost strength of a government sector is its presence in terms of infrastructure, its universal presence in terms of infrastructure, manpower. You go to the smallest and most remote village of a country or a small hamlet of few houses and you will find some health functionary there, either the Asha bin or Anganwadi worker. It has support in terms of the huge resources. Like we always hear a statement, money is not a problem, resources is not a problem. But the fact is that the government sector has got huge resources at its disposal. It is vested with the authority. And this authority, plus the backing of agencies, which are either the implementing agencies or the regulatory agencies. Now, in this regard, I would like to share with you one incident during my working at G6. I will be quoting such examples in between also. Few of you may remember in 2010 we had a event called a Red Ribbon Express. It was a train started, flagged off from Delhi, covered the entire country. It had several bogies highlighting the messages and knowledge regarding HIV/AIDS prevention. It used to stop at defined stations for a day or two. People, mostly the students, used to visit and acquire a lot of knowledge from that. It was a successful thing. It was world over appreciated this uh, intervention. Now, what happened? The train started from Delhi, went all over the country, and at the end, while returning, it came to Gujarat. It stayed here about for 10 14 days, entered from Valsad, and was to enter from Palanpur to the Rajasthan. So, one of my colleague, who is Mr. Hardik Shah, he was IC officer, he came to my room and said, "Sir, tomorrow is the last day. The train is going to halt at Mehsana and then it will straightway go to the Rajasthan. If we look at the footfalls, we are short of some 4,000 footfalls to Tamil Nadu. Tamil Nadu is ranked as number one. We are second. So if somehow tomorrow we can manage 4,000 or more footfalls, we will be number one in the country. And obviously, we're working in any organization. We look for the such achievements because it gives us appreciation from our higher ups, recognition from the higher up. So I said, okay, let us try something. So generally, I used to avoid talking to the IS officers directly, and we used to do this communication through our project director, who used to be the health commissioner. So I tried to contact my health commissioner that time, but somehow he was not available on the phone. It was 6 p.m. in the evening. Train was to reach next day in the morning. So I got the number and called Collector Mehsana. Very young, enthusiastic officer. Now he's pretty senior in high positions. I called him, sir, I want to talk to you. This is this thing, situation. He said, what do you want from me? Because, sir, just ensure that we get 4,000 footfalls. I know it is very late in the evening, but somehow my commissioner was not available, so I had to call you directly. So I got late also in this regard. But if you can ensure some 4,000 footfalls, because next state, Rajasthan, is a very small stopover, they cannot cross our footfalls. He said, okay, let me try. That is what he said, and he disconnected the phone. Now, you know what happened next day? We had 10,000, more than 10,000 footfall on that day. Because the biggest authority, according to me, in the country is district collector. Within that district, he's whole soul. So I don't know what he did. At 6 o'clock, I called him, but somehow he managed, and we had 10,000, more than 10,000 footfall, and we was number one. So that speaks about the authority. Second thing I will say about the government system, the strength is it is blamed that it doesn't perform, works very slow, but when it comes to work, it does work. Where nobody works, it is a government system that is working. Now, government system faces a problem of accountability and responsibility. An NGO can have a choice to work. I will work only in these topics. I will work only in this particular district or in this area. But government sector doesn't have a choice. Every village, every small hamlet, every town, every sherry is covered by one administrative unit, one Tarati, one Anganwadi worker, one sub center, one PSC. So you have to do. If a program is planned, thought of to be implemented, maybe in a phase manner or one go, but every area has to be covered. You cannot say, okay, we will perform in this area only and we will leave this area alone. Now, government system is often accused of being slow and tardy, especially when it comes a matter of procurement and recruitment. Now, there are so many safeguards which have been in place since British era. They were basically to safeguard, to prevent the corruption and the malpractices. At times, they are also used. I will not deny that they are also used as an excuse for not doing something. But now the workforce. You know, population of the country has increased. Work at every office has increased multifold, and the recruitment has not been able to keep pace with that. So there are fewer employees. There is a shortage of manpower all over, and that includes the government sector also. So that is one reason for this slow and tardy process. Now comes the question of corruption. I will not deny that corruption is there in government sector, in certain departments and some people. But then it is true for every department, every sector, whether it's a government or non-governmental. Now, whether during my tenure I was corrupt or not, I cannot tell. But this is to be judged by my superiors, my subordinates, and the end users, who are mostly the NGOs. My one-liner in this regard has been that government, that in government when you work, you come and go to your office in time. Do not be afraid of transfer. Do not do anything for your personal gains. In that case, even the Honorable Prime Minister or even the Honorable Chief Minister cannot do any harm to you. If you are non-corrupt, now another thing happens, the corruption originates from the top and percolates to the down. So if you at the top is non-corrupt, believe me, there will be minimum or nil corruption in your organization. And it is not uncommon to find honest government servants. I have been blessed to work most of the people, my superior, my colleague, my subordinates, who have been honest. Lastly, I would say that if you do not submit for the unfair demands which are made initially, later you are not subjected to unfair demands and improper interference, whether from any end or any corner. Next, we move to the what are the strengths of NGOs. In GSEX, I worked with NGOs mainly in the two departments. Namely, one was the targeted intervention, where we used to work with the subpopulation of vulnerable for HIV and AIDS. Basically, they include three population. One is the female sex workers. Second, we call men having sex with men, or commonly referred as homosexuals. And thirdly, it was the injecting drug users. Now, what I would say, the government sector lacks a sensitivity. In general, I am saying, to deal with such vulnerable population. And working with such population is possible only by involving the NGO sector. I still remember then when we used to call meeting of CDHO, Chief District Health Officers of our state, and I used to open up this topic of homosexuality. They will put their head down, keep on smiling, giggling, looking at each other. Because what happens, people, based on their perception, their experience, do not believe that such population exists. See, 5 to 10% people by any statistics are MSM in by nature, but in any sector, most of the time they conceal their sexual preferences, so people are not aware of that. So the government officers many times they simply do not believe that such group exists, and they say that this is an NGO's ploy. They have created this problem so they can grab the government funds. And this, I remember one very senior officer who said this thing me on my face. This is all your ploy. So NGOs make money. There's nothing like this exist. I have not seen any homosexual in my life. I don't believe it. But somehow that gentleman joined our organization later for a very brief period. He said, "Show me." We took him to an NGO, and there he saw hundreds of MSM. And then he said, "Okay, I never knew that such problem exists and so many people are there." Similarly, we had an inspection visit from the Sachivalay, where 3, 4 people, including finance officers, section officers, came. They also said the same thing when they were taken to the field visit. They said, "Sir, this is the first time we came to know about such problems that do exist." Believe me, you have to be non-judgmental when dealing with such population. It is not very easy. Initially, I also had problem in communicating with these people. But once you get exposed, and if you have that non-judgmental attitude, you can work with them. So that is a sensitivity. There are sensitive populations to be dealt, NGOs are required. Second strength of NGO is the flexibility of working. They do not have to follow the government rules, regulation, for even for procurement or for the recruitment also. Now government is also adopting the same model. They do away with lot of such old age procedures, because district level, state level societies are being formed in various health programs to do away with such obsolete procedures. NGOs have a choice, they have a flexibility that they will work on this subject. They say, "I want to work in RCH, I will work in RCH, I will work only for tuberculosis, I will work for tuberculosis. I will work only in this district because I have got a strong presence over there." Now, minded government sector doesn't have the choice. They have to cover the entire state. Then comes the acceptance. Needless to say, NGOs have got better acceptance in the community, especially when they are working with a peer-based model. They involve the end users, vulnerable population in this case, or even better when they form a community-based organization which is totally formed and run by the end users, people. The example is PLHIV, people living with HIV/AIDS. They have their own CBOs. And here only I learned that the involvement of vulnerable people, or I would say end user, is essential not only for utilization of services, but also while you plan the service, you implement the service, or when you think of the program, because then you get the real outputs from these people, that how a program can be successful, how it can be total failure also. Then comes the question of reach. Reach, I will say there are two reach: vertical reach and geographical reach or the horizontal reach. NGOs lack geographical reach. There are places where you don't find any good NGO. There are places where you find good number of NGOs. So this problem is always there. But wherever they present, they have got a good depth. That is, they have got a good vertical reach. I would say that. You all know the example of Gadchiroli experience. Gadchiroli is the easternmost district of Maharashtra, infested badly with the Naxalites. Dr. Abhay Bang and Dr. Rani Bang, team of these two guys, are working there, involving the local people, and they have brought down the infant mortality and maternal mortality rate considerably. But the problem is that replicability. They could do it because they had commitment. They could develop the reach by involving the local people. So much so that people say that Naxalites don't trouble the staff of their project as on now. But problem is how many Dr. Abhay Bang or Rani Bang you have in our country. How many places we can do that? So the problem with NGO based work is that they can have a reach, but they do not have that generalizability or replicability where the program can be carried out elsewhere also. Of course, the other thing is when you involve female sex workers or the man having sex with man in your program, they are recruited as counselors or peer group, peer model, then program will have better acceptance in the community. Now comes the question of the financial autonomy. Now this is something which is very essential for every NGO that they have, if they have to survive, they have to have the financial autonomy. An NGO should be financially viable and should not depend on the long run on the financial assistance from any organization, whether it's a government sector or any other funder, because such dependence on the long term basis will influence their priority areas and also their decision taking. Believe me, if NGO does not attain their autonomy, financial autonomy, then they lose their independence. How NGOs can be saved from indulging in corruption? Again, I will quote one example from my work while I was working in the GSEX, State AIDS Control Society. We had some, I don't remember exactly, some 60 odd NGOs which were working with the vulnerable populations. They will submit quarterly their performance reports, indicators, and based on the performance, we used to release their funds 6 monthly. Now, NACO has at the Government of India level has an approved action plan. They have sanctioned the budget and they used to release the fund intermittently. Sometimes it happens that the fund has not been released. We don't have the money. So if we don't have the money, how can we release it to the NGOs, even if their performance indicators have come to us? So one option is that we say, okay, the money has not come. When it will come, it will be released to you. What will happen in that case? Every NGO is not rich. They don't have money. So, but if they don't perform, then their indicators will fall down this in this quarter. So next quarter, I will not give them grant otherwise also. So they start doing the data fuzzing and paperwork. That is what they will do. So the money comes after the activities are over. So you can imagine what sort of activities will be done when the money is not released to them. It used to happen in most of the states. But thanks to the project director, who also happened to be commissioner and also MD NRHM at that point of time, we found a way. Since my commissioner was also MD NRHM, he was having a lot of money with him through this NRHM. So we used to take loan from NHM at a time 1 to 2 crore rupees, and then we will disperse that money. And once the money comes from the NACO, it has to come otherwise also, then we will return back to the NHM. This system worked so well because now NGOs they get the money released in time so they can perform. So that is how the things can happen. Then there comes the Gujarat performance in the blood banking and the voluntary blood donation. Gujarat has been able to provide quality blood transfusion services, and that time also used to rank next to Tamil Nadu only. I remember, maybe even now also. It is all thanks to the most of the blood banks which are run by the NGOs, including the IRCS, Indian Red Cross Society. Now, these voluntary blood banks have made a deep dent in the mind of the people, have changed their thinking and attitude where blood donation, I say voluntary blood donation is a norm of the life. Rather, marriage anniversary, people go and donate the blood. Even the marriage, immediately after marriage, people go and donate the blood. Besanas, they are followed by the blood donation. So this culture is imbibed so much in our day-to-day life that Gujarat ranks in the second only to Tamil Nadu in voluntary blood donation. So much so, sometimes we used to get complaint from the NACO that you are wasting the blood because blood cannot be kept indefinitely. So if it is not used, we have to discard that. But that is essential part of the system. So with this much all, I would say finally that under no situation an NGO can replace government sector, but shall complement, rather supplement the government sector for providing the services. Each government sector as well as NGO sector have their own strengths and weaknesses, but together they can make a formidable combination and can be a good change agent. That's what I will say. Thank you very much for listening. Thank you once again.